Communities across the country count on the American Red Cross for help every day. Supporting these communities is at the heart of what we do. Our work never stops, even during this COVID-19 crisis. Whether supplying blood products for patients in need of transfusions, these might be folks who need surgery, cancer treatment, or even trauma victims, or collecting plasma from individuals fully recovered from COVID-19 to help with treatment for the most seriously ill patients, we remain focused on delivering our life-saving mission each day. The topics we'll review here today will help you adjust your volunteer role to protect yourself and others from the risk of COVID-19 while still collecting the life-saving blood products communities need. The health and safety of our workforce, our donors, and our clients is our #1 priority. Welcome to the American Red Cross Biomedical Services. You're a part of an organization with a rich history founded in two powerful concepts: humanitarianism and volunteerism. Volunteers are essential to the success of a blood drive. Their role at a blood drive is to enhance the blood donor's experience, provide support in challenging situations, and deliver the mission and promote important programs. At the drive, the supervisor is responsible for the management of the volunteer staff during that blood drive as an extension of that supervisor's workforce. It is the responsibility of the supervisor to ensure a properly trained workforce that is engaged and respected. This training will help give the foundation for that on-the-job instruction. You play a crucial role in the Red Cross mission. With your help, we can succeed in providing life-saving blood to cancer and transplant patients, premature babies, accident victims, and others who need blood. We know that you will enjoy your position as you assist donors through the blood donation process. We depend on you as part of the team to provide excellent customer service, to ensure a positive donation experience for people of all cultures and backgrounds. And from the bottom of our hearts, we thank you for your generous gift of time, talent, and commitment. Blood drives are held in all different types of communities, cultural sites, and places of worship. The diversity of our blood donors helps the diverse patients needing blood transfusions. At the Red Cross, when we talk about diversity, we consider each and everything that makes us unique. Things like race and gender, religion, education, parental status, where you're from, physical qualities, and more. All the things that make us different and unique as compared to others. Inclusion, on the other hand, comes into play within the environment in which we do our work. The objective is for everyone to feel welcomed, valued, and respected wherever we're doing Red Cross work. Having a diverse team of employees and volunteers who operate in an inclusive work environment is a foundation for establishing culturally competent service delivery. Culturally competent service delivery means we provide services to a community in a way that shows we understand and appreciate the basic characteristics of that community. We will enhance our mission delivery through increased effectiveness, which comes from understanding and using all the differences in the way which make us collectively better. Some of the techniques to do this include treat everyone with respect and dignity. Always ask someone if they need assistance before attempting to help. They will tell you what they need. And when a person is communicating through an interpreter, please speak directly to the donor, not their interpreter. Identify yourself and others to a person who is blind or has only partial vision. The need for blood in the U.S. can sometimes be quite staggering when you look at it from numbers. Nearly 7,000 units of platelets and 10,000 units of plasma are needed daily. A single car accident victim can require as many as 100 units of blood, and that blood must already be on the shelves during an emergency. Every 2 seconds, someone in the U.S. needs blood. Blood travel is an interesting route to get to the patient. Starting in the upper left-hand corner, the donor donates blood with your help as a volunteer. About a pint of blood is collected from each donor, and the blood is labeled and scanned into a database. On the upper right-hand corner, you'll see tests establish the blood type and ensure that it's free of infection. Following the arrow down, most blood is centrifuged and separated into three parts: red cells, platelets, and plasma, which are stored according to their own requirements, temperature, and some require agitation. Blood is available for shipping to hospitals 24 hours a day, 7 days a week, where it is given to those in need, in the bottom right-hand corner, thanks to donors and volunteers like you. But how does that blood process get started? Have you ever been a blood donor or seen a blood drive in action? Think about your experience, and we'll look at these 4 basic steps. The first step is reception, where the donor is greeted and checked in to prepare for the process. Then he or she will move on to health histories, where their background is reviewed and physical findings help determine their eligibility to donate. They then move to phlebotomy or blood donation, and then to the hospitality area where they receive a snack and a drink to rehydrate and are observed by volunteers for possible adverse reactions. The blood donation process is actually not just one type of process. In reality, there are several procedures that may be available at either donation centers or at a mobile blood drive. The first is whole blood donation. This takes about 45 to 60 minutes and is really the most common procedure that you think of. We also can collect platelet or plasma donations. They take about 1 to 3 hours. They're typically done at a donation center, and the platelets are used to support patient surgeries, cancer patients, blood disorders, and organ transplants. After donations, platelets only have a lifespan of about 5 days. Power red cell donations take about 60 to 90 minutes and are available both at donation centers and on mobile blood drives. Understanding these procedures and who may benefit from each help maximize a donor's gift of life. You may see this matrix about maximizing the donation at donor centers or mobile blood drives. It suggests the type of donation based on blood type with the most impact for patients in hospitals. Now that you've passed a quick lesson on Blood 101, your role on the blood drive is to ensure donors and visitors feel welcome, informed, and valued. Research shows that blood donors who have a positive and educational experience become repeat blood donors. You may remember our fundamental principles that you learned in your first Red Cross orientation: humanity, impartiality, neutrality, independence, voluntary service, unity, and universality. The Red Cross remains neutral in difficult situations. Therefore, we do not discuss religious, political, or controversial views while performing the job as a blood drive volunteer. Also, if a donor corrects their gender, make a note of that and always use the appropriate pronouns associated with that gender, even if it doesn't match what you may think it should. We have a very robust self-reported gender policy that can greatly impact a donor's eligibility to donate. It's important for volunteers to know this and respect it. As the volunteer, be that cheerleader. Each blood donor does deserve to be treated as an honored guest. Engage with them. Make the donation experience fun, fulfilling. Set the stage for a long-term commitment to regular blood donations. Beyond the role of cheerleader, there are additional responsibilities for blood drive volunteers. Many are specific to volunteering during COVID-19 pandemic. We'll walk through each of these briefly now and then dive a little bit deeper as we progress through this training. First, check your own health prior to your shift. Follow the CDC guidelines and take your temperature to be sure it is not greater than 99.5 degrees Fahrenheit. If it is above 99.5, please reach out to your point of contact at the Red Cross and withdraw from this shift. Next, welcome the donors. Be sure you're wearing your gloves and mask. Take the donor's temperature, check them in, ensure that they're wearing masks and are socially distant from one another and yourself. As we discussed on the last couple slides, you'll work with the collections charge staff to help donors choose the procedure that maximizes their donation. During your shift, you'll sanitize the reception and hospitality areas. This would include disinfecting tables, chairs, pens, reading material, even the bottle of hand sanitizer if it's touched by donors. During a busy drive, you may be asked to disinfect other donor areas and beds, or you may call donors who miss appointments. And one of the most important responsibilities for volunteers is to thank every donor who came in to give blood. An assignment that you may find yourself at for most of the shift is to assist in the hospitality area. That's where we ensure that each donor is rehydrated, recognized for their contribution, and watched carefully for adverse physical reactions to the blood donation process. So, first step is to follow the CDC guidelines for yourself, for others around you, and please encourage donors to do the same. You've probably seen this lots of times, but it includes staying 6 feet socially distant, covering cough or sneeze with a tissue, throwing it away, wearing a mask in public and around other people, keeping your hands away from eyes, nose, and mouth, cleaning and disinfecting, staying home if you're sick, and washing your hands often with soap and water for at least 20 seconds. As mentioned earlier, take your own temperature each morning. Don't report for your shift if your temperature is greater than 99.5 degrees Fahrenheit. You may be assigned to take the temperature of donors and others who may need to enter the blood drive. That could be drivers, facility team members, etc. During COVID-19 operations, there will be no guests at blood drives. Here are pictured 2 out of 3 of the types of thermometers the Red Cross is currently using. On the left is the infrared thermometer, which measures forehead temperature. On the right is the mouth probe or Welch-Allen thermometer that measures the heat pockets inside the donor's mouth. Please note in the bottom right to ensure the top of the probe clicks into place when inserting the probe cover, and to insert the probe without the cover into the thermometer after each cleaning to reset that thermometer. The third type of thermometer being used currently at the American Red Cross is the Tempodot single-use clinical thermometer. This is a disposable thermometer that's being used in the transportation department. To make this work, place the thermometer into your or your donor's mouth under the tongue as far back into either heat pocket as you would any oral thermometer. The lips should touch the middle of the Tempodot logo on the thermometer. Dots can face either up or down, but do have the individual press their tongue down on the thermometer while keeping their mouth closed. Wait at least 60 seconds, but less than 2 minutes. Remove the thermometer, and then wait 10 seconds for the dots to lock in. To read the temperature, look at the last blue dot on the matrix. This indicates the correct temperature. And these thermometers can be discarded in the waste bin. Gloves are now required protective equipment for blood drive volunteers. Gloves will be issued at the blood drive and need to be changed between each donor. As pictured here, you first remove one glove and ball it into your fist. Then slip 2 fingers into the wrist of the second glove to begin removing that one. Please note that removing the gloves without touching the outside of either glove is key to avoiding cross-contamination. As part of coronavirus protection, the American Red Cross now compels everyone, including donors, to wear face coverings while in Red Cross buildings or at blood drives and disaster operations. 4 masks will be provided to each volunteer per day. The recommendation is to change these after your breaks, if you have any. Wash your hands with soap and water first or use hand sanitizer before handling the mask. Once it's on, try not to touch the front of the mask. Remove with the strings or the elastic, not touching the front of the mask, and then wash your hands after removal. Please issue face masks to donors as needed. In addition to gloves and face coverings, maintain social distancing by staying 6 feet from fellow volunteers, donors, Red Cross employees, and any other people occupying the same space. Set down items you are offering to donors, then back away from the item and allow the donor to pick them up in order to maintain that 6 feet minimum distance. If it's appropriate, use a phone or separate by a minimum of 6 feet in the same room. Please remember, social distancing and mask wearing are not a either-or choice. Both a mask and social distancing are required. This slide and drawing shows how distancing can work at a blood drive. You can see in the drawing to the right the different steps of the blood drive, including pre-screening, check-in, histories, and then the phlebotomy and hospitality in the canteen areas. If needed, separate the waiting donors by 6 feet, make sure their chairs are that far apart, and feel free to give social distancing visual cues on the floor with pieces of tape or dots or sticky notes. Practicing enhanced disinfecting is one of the techniques to keep you and those around you safe from infection. Use hand sanitizer and additional frequent cleaning of surfaces touched by others. Place sanitizer at check-in, health history, and refreshment or hospitality areas. Ask the donors to use hand sanitizer before touching donor tablets or laptops and before eating or drinking. If a donor refuses to use hand sanitizer, either perform the entry yourself or ask that they wear a glove. Ask donors to handle their own ID cards to scan into the system. Wash your hands, clean tables, chairs, reading material, donor tablets, pens, and markers. Next 2 slides will give us more detail on disinfecting and sanitizing. This infographic shows a step-by-step process to disinfect the reception and hospitality areas. Always wear disposable gloves and avoid contact between your clothing and the sanitizer. If you see that the surface is visibly dirty, clean that up with soap and water first and then disinfect using Santa cloths or cave wipes. Rub the cloth against the surface and allow the disinfectant to remain on the surface. Do not wipe the surface dry until the germ kill time has elapsed, and that's outlined on the container where the wipes are located. After disinfecting the area, remove and throw away the disposable gloves and clean your hands. If you are asked to help sanitize the additional donor areas and beds, the steps are very similar to reception and hospitality. The only exception is the added possibility of detecting blood spills or spatters. If you see any visible signs of blood, stop immediately and notify a collections team member. If no blood is visible, clean the area using Santa wipes. Use caution as the fluid may harm your clothes. Be sure to clean head and armrests and the edges of beds and chairs. Again, don't wipe the surface dry until the germ kill time has elapsed, which is typically 2 to 3 minutes. Let a collections team member know when the area has been sanitized so they can invite the next donor in. Now let's walk through the specific steps a volunteer will take once a blood donor has been screened for their temperature. After greeting the donor, encourage them to double-check the welcome or stop sign. This ensures, for their time and convenience, that they meet the basic donation criteria that's on the stop sign in order to donate today. Then ask if they completed Rapid Pass, which I'll explain on a following slide. Have them do so if needed. Once Rapid Pass is complete, have the donor sanitize their hands and then check in on the computer. They will scan their own ID. Once they finish checking in, complete a name sticker with their name written large enough to see from a few feet away. Add the time they finished checking in, and if walk-ins are allowed at this drive, print W on an unscheduled donor's name sticker. Keep track of the donors who have attended on the printed appointment sheet you receive. Highlight those who may be eligible for power red cell donations if there are openings on the machines. If you hear from the donor that they're a first-time donor, offer them extra attention and information, and do mention this to the collection team members. This is the stop sign alerting donors of COVID-19 assessment requirements. The FDA requires any individual who had a positive diagnostic test or showed coronavirus symptoms within 14 days prior to their donation to refrain from donating blood for at least 14 days after the completion of their symptoms. Hand sanitizer should be available at temperature screening, donor check-in, and at the hospitality area. If the bottles are being handled by anyone without gloves, the bottle should be sanitized along with the other surfaces and materials. Always ask the donors to use hand sanitizer prior to touching tablets or laptops and before eating or drinking. Place this sign where it's easily seen by donors. Before we move further in the check-in process, let's talk about RapidPass. RapidPass is an online process for donors to read information and answer questions on the day of their donation prior to starting their physical findings with a collections team member. It can save time during blood or platelet donations, and for the best donation experience, we recommend that donors schedule an appointment, then complete RapidPass on the donation day. The process is simple, just 4 steps. It takes about 10 to 15 minutes. Donors get started with some initial information, including zip code, so it's helpful to have that ready. Then they read through the pre-donation materials, answer health history questions, and then print, download, or email their RapidPass to themselves, or bring the printed version to the drive. RapidPass has improved our overall donor service and efficiency by shortening the time needed before and during the health history portion of the donation process. The easiest way to access RapidPass is by downloading the Blood Donor app on a smartphone or tablet. The Blood Donor app serves as a donor card with details of the last 30 donations. It also does give the donor access to complete RapidPass, track their blood pressure, their hemoglobin, and their pulse from each visit. Donors can also follow their blood journey as the blood travels from collections to processing to testing, then storage, and finally delivery to the hospital. Donors can see where it is and which hospital it goes to help save a life. As with everything in this social media world, there's an opportunity to share the experience with just a couple clicks. The hospitality area is not just a cookie and a drink. It's a chance for the donor to be rehydrated with the drinks that are available, and for the volunteer to be interacting with the donor to be alert for reactions. Typical reactions might include paling skin, slurred speech, lightheadedness, somebody acting suddenly withdrawn, or putting their head on the table. So it's important to interact and to be watching each of the donors. We try to keep donors at the hospitality area for 10 to 15 minutes and in a high school for as long as 15 to 20 minutes. If a donor does exhibit some of the reaction indicators, notify the collections team member in a calm, professional manner. While sitting with the donors, encourage them to sign up for their next donation. Mention the Blood Donor app and RapidPass if they're not aware of it. Remind them to take their post-donation instructions. And after they leave the hospitality area, ensure the sanitizing of tables and chairs between each donor. Throughout the blood donation experience, there are many opportunities to ask the donor to schedule their next blood donation. This page is from the First Choice program, primarily seen in donor centers. In biomedical services, you serve donors who may experience long waits, equipment failures, and sometimes confusing questions. Often, a significant number of donors could be upset or complaining about our blood drive, the staff, the process, or even sometimes you as the volunteer. I'm going to walk through some situations and talk about how to handle them. Please keep in mind to always communicate with empathy as we walk through these. When you are confronted with an angry or upset donor, stay calm. Don't take things personally. Seek for understanding and do your best to help the donor feel at ease. Often donors assume you're an employee and that you know everything there is to know about a blood drive. It's okay to explain that you're a volunteer or even that you've just started volunteering, and it's okay to let the donor know that you're still learning. Don't hesitate to get the charge person involved. Sometimes volunteers are asked medical questions. Please refer specific medical questions to a Red Cross Collections team member. Say to the team member, "This donor has a question about eligibility, could you help them?" versus blurting out what the concern is or calling to the team member from across the room. Remember, volunteer staff do not give medical advice. If a donor is in a hurry, do your best to honestly prepare them for the donation process time. While we never want to discourage a donor from giving, their time is important and we want to move them as quickly as possible through the process, but their safety and the safety of the blood supply is our #1 priority, and that takes time. Encourage donors to remain in the hospitality area after their donation, even if they're rushed for their own safety. There are times when donors may have to wait. When explaining this, be positive. Something like, "We've had such a great response from the community today." Check with the charge person for a realistic time estimate. Don't underestimate the time needed to donate. If the donor is unable to wait, offer to help make an appointment for a later time that day, if it's available, or encourage them to schedule an appointment for an upcoming blood drive. Do initiate conversations with donors. One of the most valuable contributions you can make is conversing with them to make their time go by faster and help distract them from waiting. Sometimes donors with appointments come in more than 15 minutes, sometimes even 30 minutes or an hour before their appointment time. While we are happy to process a donor early if no one is waiting, we do follow an appointment priority system to ensure that on-time donors with appointments do have the first priority. When talking with the early bird donor, express appreciation for coming in and diplomatically explain that we have commitments for these other donors. Try to accommodate this donor, like a walk-in, with an open appointment or offer the option of waiting until those appointments have been served if walk-ins are available that day. The bottom line is donors who are more than 15 minutes early can take an open appointment, wait for their appointment time, or choose to be a walk-in if acceptable. Occasionally, you can see that a donor is visibly anxious, or they may share with you that they are nervous or unfamiliar with the process, like a first-time donor. Please spend extra time with these donors. Acknowledge that it is normal to feel anxious. Walk them through the steps of the donation verbally. If you're a donor, share your positive personal experience. Remind them of the recipient awaiting their donation. Walk-in donors are always a challenge. We want their donation, but during COVID-19, it's become much more difficult to accommodate walk-ins. When you arrive, ask the charge person if you can take walk-ins, and during the course of the day, check in on what the estimated wait time will be. If not accepting walk-in donors, explain that a wonderful community response has filled all the available time slots. They may have questions about why others are processed first. Again, explain that we appreciate their willingness to donate, that we need their donation, but they really have to honor the commitment to donors with appointments. If they're able to wait or return at another donation time, see what you have available. We understand that a returning donor may have read this material many times before. However, the information that they need to read prior to donating may have changed. It's also possible that the donor's own circumstances have changed. Ask for their patience. And let them know that everyone must read the material prior to donation. This is an FDA requirement and helps ensure a safe blood supply. Also, if a donor refuses to wear a face mask, encourage them to come again when this is not a requirement. Sometimes a donor will arrive whose appointment is not on the schedule. They say that they've made it, but we don't see it on either the computer or on the printed schedule. The plan is to honor the appointment. If they say they have an appointment, they have an appointment, even if we don't see it listed anywhere. They may have made the appointment in the parking lot. They may have made it in the morning of the blood drive. Either way, they are considered to have an appointment. And the last challenge that I wanted you to be aware of are donors who are more than 15 minutes late. If a donor arrives more than 15 minutes late, they may be considered a walk-in, if that's allowed, or they may fill a open appointment that was not scheduled. If they're more than 5 minutes late at the end of the blood drive, they will probably not be able to donate that day. With any of the challenges that we see at a blood drive, please know that the charge person is your resource during the course of the day. Ask questions, find out how they'd like things to be handled. They are your supervisor on the day of the blood drive. On the day of the blood drive, another activity you may be asked to complete is to contact donors who did not keep their appointment, also known as no-shows, or contact donors whose appointment needs to be canceled. It may be that we're out of supplies or that things have moved slowly and we're severely behind schedule. While phone calls are the preferred method of contact, you may also text donors. Phones are not provided on site. If you're comfortable using your own phone, know that we are very grateful. The temporary way of keeping your mobile number invisible from caller ID is to dial *67 before you dial their phone number. This temporarily deactivates your caller ID. Donor confidentiality before and after this outreach really must be honored. Calls or texts will be made to donors who have not presented at the blood drive within 20 minutes after their scheduled time. If you are asked to perform this task, ask for a donor schedule from the charge person. Then plan to use the following tally system so the Red Cross has an accurate count of your activity. Tally the number of donors you called or texted who were on the schedule but didn't show up. Also tally the number of donors who presented after you did call. Give that schedule with the total tallies to the charge person at the end of the drive. We know that sometimes the hardest part of making calls is knowing what to say. It's okay to stumble over your words. It gets easier each time. Here's some of the scripts. Call and say, "Hi, this is Cheryl. I'm a volunteer for the American Red Cross, currently at XYZ Blood Drive. Thank you for scheduling an appointment to donate blood. I'm calling to see if you still plan to donate blood today. We missed you this morning at 10. We are here until 6 p.m. If they say no, then say, "Thank you for letting me know. We are in an urgent need for blood due to the coronavirus. If you are able to donate, please visit redcrossblood.org. One of the most important things in setting the stage for donors to return to donate blood again is to make sure that each and every time that they come, that we give them our thank you. Their generous support helps us deliver life-saving blood to patients in need every single day. Please remember to thank each and every donor." Here's a summary of volunteer tasks and responsibilities. Follow CDC precautions, take your own temp each day, wear gloves and masks and ensure 6 feet of social distancing, practice enhanced disinfecting, check the donors' and others' temperatures, have the donors wear masks and clean their hands with sanitizer, request that they read the COVID stop sign and information sheet, check them in, be prepared in case you're asked to sanitize donor areas and beds, and then call donors, if asked, call donors who did not attend their appointment. Ensure that each donor feels well at the hospitality area And as I just mentioned, thank every donor. Taking care of your physical health is, of course, very important, and we've covered that in a lot of detail. But during times like these, it's also important to take care of your emotional health. Please know that others are struggling with stress and worry during this pandemic, as you might be also. Take care of yourself and those around you by following some of these tips. Get accurate information from credible sources such as the CDC and the Red Cross. Understand the risks and know how to protect yourself and others. Stay connected to friends and family, maybe by phone or video, or chat in person from a safe distance. Take breaks from media coverage. Limit your exposure to the news sometimes. Take practical steps to manage stress, such as taking walks, getting outdoors, maybe even meditating or exercising. Do what works best for you. Know that additional support is available on the exchange in the Well-Being Toolkit. Now, imagine your impact. As a blood drive volunteer, you are crucial to the mission of the Red Cross. Thank you for your volunteer service, the generosity of your own time, talent, and dedication to the mission. Because of you, we can succeed in providing life-saving blood products to cancer and transplant patients, premature babies, accident victims, and others who need blood. Thank you for completing the Blood Donor Ambassador training and for your service as an American Red Cross volunteer.